Okie dokie. Thank you for joining me for week 3. Can you believe it? Week 3. We're 25% of this course already. Well, it's the beginning of week 3, but still, that went fast, right? Okay. So we have two main things we're going to talk about tonight, and that is, of course, your final project, the EHR implementation project. That was due yesterday, but I'm going to start talking about the next step. And then, of course, RHIA domain 1, which is up for your consideration. All right. First, the overview of this week is there's a video for you to look at. And there are chapters for you to review that are specifically related to this domain 1. The practice exam. Now, remember, this is for you to start. This is part of your preparation to take the actual exam. So I would like you to take these practice exams, no books, just your brain, your memory, your little gray cells, okay? Because that will really test you on what you already know and what the gaps are that you need to fill in. And then, of course, we have our week 3 discussion forum. Yay. Okay, so I can't emphasize enough that you need to make sure you are using the correct information for the outline and all the information for the exam. And that is, you are looking for the one that is effective March 1st, 2021. There was a previous version from November 2020. Too old. You have to make sure you're using an outline from which to study that matches what is actually going to be on the test. Okay. So you have to pay attention to the little things. The RHIA exam outline is posted under content in module 3. And for domain 1, this is what it looks like. And notice again, effective March 1st, 2021. This is really important because they just changed the content of the exam. They change the questions every year, but this year they actually changed the content. The outline is different. You don't want to be studying for the wrong test. Okay, so let's go over these 7 tasks, and I want you to focus on the verb. Okay, evaluate, apply, understand, manage. The verb is what is very important. In other words, as you're studying, make sure you understand what the integrity of healthcare data is, how it's measured, but how it is evaluated to make sure that it has integrity. What do you have to do? One thing about management position, and especially in a master's degree program, this is not all about dittoing statements. This is what this is. This is not about definitions. This is about use. How are you going to use the knowledge that you've gained to process the required clinical data elements for quality reporting? Okay, so this goes beyond knowing what the clinical data elements are. You have to understand why those specific elements are required. Understand and apply data dictionary standardization policies. So you need to not only understand what a data dictionary is, You need to know what the standardization policies are in the healthcare industry, and you have to understand how you will apply this. How will you use this? I want you to imagine yourself in your job that you want after graduation. It might be the one you have now. And you are making decisions. You might be making a presentation to the executive board. We need to do this. Or you might be just creating policies and procedures to implement through the facility. You have to know not only what things are, but how to use them. Manage data standards based on organizational policy. Okay, again, I want you to pay attention to the verb. Complete data analysis to inform management. So what this means, and this will be on the test, I promise you, is you not only need to understand how data analysis is done and why it's done, but you also need to understand about graphs and charts and figures, so that you can not only interpret the analysis, but show the board pretty pictures, line graphs, bar charts, and things like that, so that they can understand. And I will tell you, there will be questions on this exam where they will show you a chart and they will ask you what it is. Is it a bar chart? Is it a line graph? Is it a run graph? Or they will give you information and they will ask you, what is the best type of chart or graph to use to express these details? Apply knowledge necessary to develop policies and procedures for data management and information governance. Okay, and looking at some of the discussion posts that we have this week on information governance, I'm going to reiterate that you must make certain you are using healthcare industry sources. Information governance in the banking industry, information governance in the tech industry is not the same as information governance in healthcare. And reason number one is we have more laws, rules, and regulations than almost any other industry. And rule number two is we have people's lives involved in what we're doing. And you may say, and I know I said this last week, you may think, well, I'm working in the administration offices. I'm health information management. I'm not touching patients. I'm not seeing patients. You still are impacting their lives. You still are part of the healthcare team, because if your billers and coders are not doing their job properly, you will interfere with the treatment and care of a patient. You don't have to touch somebody to cause them great stress and great harm. All you have to do is mess up their information. It's seriously as easy as that. Okay, and manage health record content and documentation. And this has to do with knowing what is required in the healthcare record and making certain that documentation is done in accordance with the Joint Commission as well as the other laws that stand with regard to what must be there. Health information managers and health informatics directors are in charge and have the authority to stop a physician from treating patients in the facility if they're not getting their documentation done on time. And that includes operative notes that must be completed as soon as the surgical event is over, meaning 10 minutes later, not a week, not a month, not 2 months. This is part of what you are in charge of. This is part of what you are responsible of. Okay. All right. So any questions about domain 1 for the RHIA? Okay. All right. Now I just want to touch upon, this is not due until 2 weeks. Okay. 2 weeks from yesterday. This part, step 2, is going to talk about workflow changes. And workflow basically is how the information goes from one point to another point to another point. Okay. That means that the patient will be interviewed by the physician and the nurses, and they will document things in the patient's chart. And then that is going to be, maybe the patient's going to go down the hallway to imaging and have x-rays, and then we have to wait for the radiology report and the pathology report if they're having labs done, and all of that comes into the chart. And then the medical coder has to review the chart and interpret into codes, and then the biller will transform all that information along with demographics into the claim form. That's one example. Okay, so you need to understand your project has a facility changing from paper to plastic, right? Nobody even smiled. Okay, thank you, Brian. I appreciate that. Okay, from paper to plastic. Your computer is made out of metal and plastic. All right, not as funny as I hoped, but I got my sense of humor from my father. May he rest in peace. Not my fault. Okay. So we need to look at, you need to look at how workflow has changed from when they were using paper to now that they're using electronics. For example, one of the great things about using EHR is the fact that the nurse can be putting notes in to the patient's chart while the coder is looking at the chart, or while the biller is working on that chart. In other words, the chart can be in 3 different offices at the same time, not correct with a paper chart, which can only be on one desk at a time. That's just one example. Okay. Remember that health informatics and information management professionals are in charge of collecting data and storing data. So this is number 2 point, is talking about how you are going to store it and protect it, because that is your job. Now, just as a point in time, or a point is paper-based medical records must be stored in a file folder, which will then be put into a lockable filing cabinet, which needs to be in a temperature controlled locked room. At some point, there will be more records than there are filing cabinets, than there are room in that room. Then they have to go to a secondary location, which means they have to be stored in temperature controlled locked filing cabinets. Whereas storing digital health is a piece of cake. First of all, you could take one entire room of filing cabinets filled to the brim and record it on one DVD. So that makes it much easier to keep records longer, and much easier for a physician or healthcare professional to reference, oh, the patient was in this hospital 5 years ago. Normally, in order to get that 5-year-old patient record, when we were still in paper is somebody would have to be sent to the storage unit to go get it out. Now we just hit the keyboard, but you will need temperature controlled for servers. You also need to consider both on-site servers and off-site servers. You know, one thing that I found was incredible, a lesson that we in healthcare learned after Hurricane Katrina. Do you remember Hurricane Katrina hit New Orleans about, what is it, like 11 years ago now? Well, back then, everybody was using paper. Well, not everybody, but a lot of people were using paper. Every physician's office that got flooded, the patient records were gone. Gone. Even hospitals that were using paper, gone. And there were some hospitals that were electronic, using digital health records, that were okay, depending upon where the servers were, but usually they were in the basement. But then we had a group of hospitals that were using storage servers, basically what we now call the cloud, except we didn't call it a cloud then, but they were servers in other states. And all of that backup information was safe. Not a comma, not an exclamation point. Lost. So you might say, well, we're in Maryland. We don't have to worry about a hurricane. Well, that's not true, and you already know that. But what about, okay, but I'm working in a hospital in Kansas. We don't get hurricanes. No, what do they get in hurricanes? Tornadoes. Very destructive. The point is yes, you have to think about emergency situations. And also remember, when a hurricane or a tornado comes and does damage, that's a hospital's busy time. I mean, people get hurt and then they come to the hospital. This is not a time for you not to have any patient records, no information, no ability to look up stuff, including CDSS, which is Clinical Decision Support Systems, which enable the physician to quickly connect to current state-of-the-art research information so they know what the latest drug is, how it's performing, what's better for these patients or those patients. Okay, so storage, and then of course you have your data warehouse, which holds a data mart. All of that stuff is all part of your job. It's all part of your realm. You got to know about it. Okay. Some examples for you to consider when working on step 2 is scheduling, appointment making, and check-in of patients. Don't forget, check-in is where we check, get demographic information, as well as next of kin, as well as insurance information. All of that is important. Assigning patients rooms. Again, this goes outpatient or inpatient. Even in a clinic where it's not really a room, but it could be a curtained off area, still, you got to make sure that you know who's who, where, and what they need. Triage, okay? This is a part of triage. There's clinical triage where you're looking for who needs care the fastest because they have the most acute, the most severe injury or illness. And then you have administrative triage. Refilling prescriptions. Okay. Go on the patient portal. That's good. Make a phone call, whatever. The point is, you want to make sure that it is a smooth, and again, depending upon the type of facility you decided you're working with, okay? In other words, renewing medications is very important if you are running a diabetes clinic. Okay, all right. Sending prescription to pharmacies electronically. This is known as CPR. computerized physician order entry. Now, instead of filling out a little prescription pad, physicians will use CPOE technology to type in a prescription and email it, so to speak, to a pharmacy. It's expanded to include emailing an order for x-rays, MRI, CPT to the imaging department, even if it's a separate off-site facility or lab work. This is very important. I hope you know that when CPOE was first accepted or adopted in the industry, the first year with just prescription, just electronic prescriptions, it was tracked over 50,000 lives were saved in the United States the first year, because pharmacists did not have to worry about trying to figure out the physician's scribble. Patients didn't have to worry about losing that tiny piece of paper. And I'll tell you the one thing, when I personally got to enjoy CPOE, I was at the doctor's office and I sat there in the exam room and the physician typed in my prescription and sent it to the pharmacy. Okay. I checked out, went through the front desk, blah, 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 go downstairs. As I hit the parking lot, I get a text message on my phone from Walgreens, the pharmacy, that my prescription is ready to pick up. And you may say, well, that's really, it is really cool. But think about somebody being discharged from the hospital, or even somebody coming back from their physician's office. They're not feeling well. They don't want to go to the pharmacy and have to sit in the corner in one of those hard chairs for 45 minutes while they're filling their prescription. Or maybe they drop it off and they go home, but then somebody's going to have to come back and pick it up. This software makes it easier and better for patients to get the correct medicine in the correct dosage with the correct instructions, and makes it easier for the patients to comply with the doctor's orders, which means improve patient outcomes. It's as simple as that. And then, of course, remember health information entry timestamps. This is something the computer will do automatically. If you remember back when we used to have paper, if any of you are old enough to remember when there were paper records, if something had to be added to the chart, you had to put your initials, the time and the date that this was added to the chart. Well, now you don't have to worry about that anymore, because the computer's going to do it for you. The computer knows who you are and what you're doing and what you're looking at. We'll discuss that in a future section about tracking people who are looking at patient records when they shouldn't ought to be looking at patient records. Okay. Okay. Any questions about step 2 that's coming up in 2 weeks? All right. I hope to get your step 1 that you submitted by last night graded by the end of the weekend. I'm going to try. I know that you're anxious. I was always anxious. Okay. A notation: compare your visit to your own physician or hospital before and after the implementation of EHR. I don't know if you can do that, but I think that most of you can remember what working with paper records was before and what it is now. And if you need a list of 455,000 different ways that EHR is better than patient records, just email me and I'll be happy to share some of them with you. Or better than that, just Google it. Okay. All right. I said I was going to keep this short and sweet. I hope you found benefit in my whatever this was. Okay. Any questions? Okie dokie. I hope you all had a good holiday weekend. And as far as I'm concerned, I am always here for you. Just email me. We can email back and forth. We can make a phone appointment. We can do a Zoom. We can do a Skype. We could do a FaceTime. I am multi-talented in the technologies somewhat, but the point is I'm here for you. Okay. So no questions. Have a good evening and I will see you in the discussion board. Oh, wait, we got a chat. Oh, 2 questions. Okay. Oh, have a great rest of your week, everyone. And thank you, Ashton. All righty. Have a good night.
Thank you.
Thank you.
Bye.
Thank you.
Bye.